So, our first guest is Laina Latterner. With over 17 years of experience in healthcare sales and marketing across diverse organizations, from startups to Fortune 10 companies, Laina empowers changemakers and leaders addressing critical healthcare challenges. She excels in strategic thinking and sales coaching, driving innovative solutions and stakeholder collaboration to achieve revenue growth and organizational alignment. By leveraging her industry knowledge, she informs clients of impactful trends and has helped numerous small businesses identify key areas of opportunity while staying true to their core principles. Laina, please tell us about your work.
Don, thank you everyone for joining. So I'm going to share a quick slide that I put together so that it makes it a little bit easier for you all to understand exactly what I do without wondering how that affects you. So I titled this Meaningful Impact because I started Windmill Solutions after I left corporate in order to make a meaningful impact in healthcare. And I had originally been in Fortune 10, Fortune 500s in all aspects of sales and marketing, and with almost any product you can think of. And when I left, I was like, gosh, I really want to make my mark on healthcare and do it in a way that matters. And so I was focusing on women's health. And as I went to all of these startup accelerators, I realized that a lot of my counterparts didn't have the background, the training in sales. And because of that, they didn't feel as confident. So I pivoted and started to consult and coach people on how to sell in a way that felt authentic and felt like they were making connections and being genuine to themselves and their mission. And so that is what I have done with Windmill Health Solutions. This is what I hear all the time. So when I was trying to figure out what to talk to people about, I was like, okay, this is what everyone's been saying to me lately is I'm stuck. I don't know what to do. And so I'm just curious, has anyone else on this call felt like that lately with what you're trying to do? Denise.
Yeah.
Okay, thank you for participating and raising your hand. I appreciate that. So there's a lot of different reasons why people feel stuck, but when I talk about it and when they're talking to me, it's more about making the connections or they're getting these amazing connections through friends, family, professional relationships, but it doesn't really get to the end where they sign up for their product or they join their community or whatever else it is that they're hoping to get, a sponsorship, a partnership. And so I wanted to share that that is totally normal and a few of the top challenges in sales across the board so that everyone knows that you're not alone. Because what I have learned over my years of sales is that getting a no or getting ghosted is very normal. And you just have to get through a certain number of them before you get to a yes. So a couple of things that really stood out as the reason why people are getting stuck in those spaces is one, 72% of the opportunities don't show an ROI. So whatever you're sharing with that client, it's not really resonating with them. The next one is 47% of opportunities don't involve the right people. So sometimes you'll meet that person who's like super, super friendly, and you're like, oh my gosh, we just had an amazing conversation. And then you get to the end of like what you think is your process, and they're like, oh, but I can't sign that contract. And you're like, okay, well, we have a really great relationship, but that didn't really get me to where my goal needed to be. And then the last one is 60% of opportunities are actually marked as ghosted, in other terms, sometimes by potential clients. So I wanted to share all of this because I think for those who have not been trained in sales and have not done it professionally, but now are finding themselves in a position where they have to do that on top of trying to promote their mission or their change that they hope to make in the world, they're getting really frustrated and down on themselves. And I want to share this so that everyone understands this is completely normal and it's part of the process. It is nothing personal to you or your mission. A few of the solutions, and this is what I generally am able to offer to people, and I'll talk more about what I can offer to those on the call today, are going over three different topics. The first one is pain points, and it's not just for you, but it's for your clients. It's understanding your clients' pain points and even potentially their clients' pain points. So really moving down the road and understanding the why behind all of these potential challenges that they might be having and not just what we assume. And I laugh because oftentimes I'm like, it's sort of like talking to your best friend where they're like, God, I can't believe this happened. And you immediately know six different data points of why they're upset about this. It's not just because you've inferred from your own perspective. So it's really just knowing people, which leads into the second one, which is people. making sure that you have the right people at the table, making sure that you're continuously asking questions. Is there anyone else that I should include? I talk a lot about this with my kids, even because they're 10 and 6. And I'm like, did you include everyone who may have wanted to be included? Did you leave anyone out? How can you ask about that? And it really gets to the point of making sure that everyone who wants to be included is invited to the table, and they may actually bring something extra to that whole process that will give you an insight that you didn't even realize existed. And that leads to the third one, which is processes. So this goes directly to getting ghosted, which I know for a lot of people who are dating, that happens a lot very frequently. So it's all over TikTok and whatever else. But it happens a lot in sales, and it's really painful because your livelihood or your mission, whatever your organization values and vision is, depends on it. And so it's really important to have a clear process of what you're saying, how you're saying it, and how many times you reach out to people so that you can lean back on that process when you're feeling super low, super discouraged, and almost desperate. And so it's really looking at those three key points. And that's really what I wanted to share today with everyone on the call and anyone else who you might be talking with, because those are some of the top things that we uncover with a lot of my clients. And it's able to get them out of that muddy, stuck feeling and into the next spot. A couple things. What I have to offer is a sales growth checklist, which I hesitate to use the term sales because I know it puts people off. I will say most people are selling something, whether it's an idea, a product, a service, whatever it might be, a connection. And so it's just a good checklist to see, do I have the information I need? Have I asked the questions I wanted to ask? And what is my actual goal when I'm talking to someone? And I use this a lot when I'm doing network training as well for people so that when they're networking, they aren't getting totally burnt out. I can also offer a call to go over the checklist with you. But if you know someone else who you're like, I think they might be able to use some of your services, my ask is that you share my email address with them and share this recording so that I can talk to them and see if there's an area where I might be able to support them or someone else that they know.
Laina, I'm curious because you also have a group, a network forming around you in regards to some of this work that you're doing. So it's not just you and the great skills that you offer, but you're actually pulling in others with different resources and capabilities. Can you speak a little bit to that as well?
I'm based in Minneapolis, Minnesota, and I've connected with a lot of other folks who are in the healthcare space who have worked as physicians or in really any of the back end business spaces of healthcare. And we've connected together and created a group that attacks kind of all of the non-exciting parts of healthcare that people who are running organizations or trying to like bring their mission to life need, but struggle to find the right people to help them. So it's called the Healthcare Referral Network. Like I said, I have a physician on staff who worked at Mayo Clinic, had his own clinic for a long time, now acts as a chief medical officer for, I think, 13 different nursing homes.
Mm.
He also acts as a startup advisor for medical startups. He and his wife also have a leadership organization where they train physicians who are getting promoted in healthcare on how to be a good leader because they've already gone through many years of training on how to be a physician and not the other aspects of management. We have folks who are in financial advising and specifically cater to physicians and people in healthcare and the unique needs they have. And then we have others in marketing, branding. I do sales. We have someone in legal. So it's really all of those areas where, as a business owner or as someone who is a leader and is looking for trusted voices, we've vetted each other to say, are you a good person? Or are you going to keep playing devil's advocate this entire way through? And people who are really experts in those areas. So I'm hoping through some future work with Denise and Dawn to bring space on HRC platform there so that people can go and see who's available if they ever need help.
Mm. Excellent. Thank you.